Hello friends, welcome to my channel. This video will give you an overview about medical writing and it will help to make notes for your examination purpose. Now, what is medical writing? It is the fourth most frequently outsourced service. Medical writing is the creation of well-structured and well-written scientific document that present information clearly and concisely. It is the combination of science and art. Medical writing needs an understanding of medical science and art of writing. Who needed medical writing? Pharmaceutical industries, healthcare product companies, clinical research organizations, medical institutions, principal investigators for research projects, journal editors for improving compliance with guidelines, scientific content and healthcare communication companies, some BPOs and KPOs all needed medical writing. Medical writing is of two types, regulatory medical writing and educational medical writing. Regulatory medical writing requires in the approval process for drugs, devices and biologics. Regulatory documents are used and prescribed. For example, clinical study reports, patient informed consent forms, etc. Next is educational medical writing. It includes writing documents about drugs, devices and biologics for general audience and for specific audience such as healthcare professionals. Examples of such type of writing are sales literature for newly launched drugs, medical journal articles for nurses, physicians and pharmacists, data presentations for medical conferences, etc. These well-structured scientific documents include medical journalism. In this, newspaper and magazine articles. These are mostly for general public and lay people and should be written in simple and non-technical language. Another one is medical education. For physicians, textbooks, continued medical education programs, slide decks, e-learning modules, and for patients, patient education material. Next is medical marketing of healthcare products. Promotional literature targeted at healthcare professionals, product monographs, brochures, handouts, internet content for physicians and patients. Next is publication or presentation. Journal articles, manuscripts, abstracts, posters and presentations for scientific meetings and conferences. In research documents, it includes clinical trial protocols, investigators' brochures, informed consent documents, study reports, research proposals. In regulatory documents, package inserts and patient information leaflets, clinical study reports, post-approval documents, etc. Now, steps in writing scientific documents. Firstly, medical writer should understand the purpose of writing the document. After that, he or she should start literature search and review that will give valuable information. Then, compilation of document. Obviously, the first version of the document takes time. After compilation, review of document is important by senior medical writer or subject matter expert. After the review process, formatting and editing of documents are also an important step. Formatting means checking text font, text size, line and paragraph spacing, etc. And editing means checking the spellings, punctuation marks, correct use of tense, appropriate reference style, etc. After formatting and editing, documents are approved and signed by high authority. And last, the publication for online and offline access. Who can do medical writing? Graduate and postgraduate in life science who have the right skill and aptitude for writing can do. As I have mentioned earlier, a thorough knowledge of specific requirements for different types of medical documents and keeping up to date with the relevant guidelines is also must. Scope of medical writing is tremendous and growing. Medical writer can practice either independently as a freelancer or as an employee in an organization depending on his experience, level of expertise and liking. This is all about medical writing. Thanks for watching.